Thank you again, Professor Lim, for agreeing to this interview. We're hoping to be able to give the exiting candidates who will be taking their exit exam in a few weeks' time some idea about the current structure of the exit exam, as well as any advice you can share, any tips for the exiting candidates.
Okay, these are just some of my own observations. These are not official instructions or briefing to be given to the exit exam candidates. My own view is that what we know is that the exit exam is over half an hour. You've got an hour to read a journal article, and then you're going to scribble some notes and prepare yourself for the questions that will follow. They will ask you to do a journal critique. That should roughly take about 10 minutes or so. And you want to read through the paper, know the methodology, know the aims and the hypothesis, the strengths and the weaknesses of the paper. So basically you will cover all these elements of the journal article. But don't give everything all at one shot. When you're asked to give an overview, just give an overview of the aims of the study, the introduction of the study, what has been known in the world literature concerning the study, and why is the study so unique, and give some idea of the methodology. Okay. Then later on they will ask you about the strength of the study, or the findings of the study, and then you tell them the findings. You must be able to interpret the graphs and tables and a bit of the statistics. Don't worry if the statistics are very complicating, because examiners also may not know the statistics. And then the limitations. I don't know whether they cover up the limitations in the discussion section. But if they cover it up, never mind. You just look through and see whether there are any things which are not clearly stated in the methodology, whether there is blinding, double blinding, whether there's bias. These things you can comment on. Anything they're not sure of, that the authors have not made clear in their methodology or in their findings, you could mention that. But don't be too critical of the paper. Obviously, if the paper is so badly written, it wouldn't have been published in the first place. So also give some merits to the paper and to the hard work put in by the authors. So give a balanced view. Now that's the journal critique part of it. Then there's a vignette. They will have a difficult case vignette. It will be of a more difficult standard than in the Part 2 exam standard. Now, Part 2 exam we don't have vignettes, but in the past we used to have vignettes. To be sure that it will be something more complicating than just a diagnosis. There will be some medical legal issues, for example, or there may be some area of risk assessment that you need to make. It's very important, risk assessment, and how you not just risk assessment, but let's say medical legal issues and compulsory admissions and things like that. So you need to know a bit about the Mental Health Care and Treatment Act as well. How to deal with families and relatives as well. So the case is not just dealing with the patient. It's a bit more involved than that. It may require liaising with other, shall I say, other agencies, and police and courts and social workers and agencies outside of the hospital. So then you're left with the final 10 minutes or less. Then they can ask you anything. They may ask you about quality improvement projects. Now you're having JCI, so they might ask you something like that. So be prepared. They can ask you anything actually in the third section.
Okay. Thank you very much, Professor.